Good evening, Dr. Ann Zink here. Just wanted to provide a brief update with what's happening in COVID. We're going to start doing these weekly updates to make sure that you have all the latest information. There are weekly updates that you can sign up for, but also including some PowerPoint slides today. So moving on to the next slide, you can see that our trend recently has been on this kind of upward projection. Remember that those gray lines out there are not part of the calculation as projection because that's early on in the epidemiology curve. We're trying to figure out when those cases started. And as we figure out those cases, they're kind of moved into that yellow section. You can follow that on our board. So you can see they've kind of started to move up into an upward projection. Moving on to the next slide, you can see the statewide alert level. So again, we've got 3 different alert levels: the less than 5 cases per 100,000, 5 to 10, or greater than 10 cases per 100,000, averaged over a 2-week period. Again, you can see these on our dashboard, both for a 14-day and 7-day region. And you can also see those based on your region. So you can choose Fairbanks or Anchorage and see what that looks for you. And you can see that we were fortunate to kind of dip down into that orange range there. And we were hoping to continue on a downward trend. But unfortunately, they've started to tick back up again. And we continue to be in that high range with an upward projection at this time. Moving on to the next slide, here's a summary of our cases for the past week. So this is reporting data from that was reported to the state by 9/30/2020. So in the past week, we've had 645 new cases for a total of 7,824. We had an additional 19 non-residents for a total of 950. Unfortunately, this past week, we have had 11 new deaths. Some of those deaths were deaths that happened previously in the week, but that got reported to us. And remember, if you have any questions about how deaths are reported, it's the same way that we do influenza reporting or any other infectious disease reporting. It's that a provider listed it on their death certificate, and we do have a site on our website that has more information. We've had a total of 21 hospitalizations this past week for a total of 283, with almost 500,000 tests cumulatively done. But unfortunately, we are seeing that percent positivity start to tick up a little bit there. So our percent positivity over the past 7 days was 2.87%. And again, you can follow your region on there. Just wanted to stop on that and really highlight the importance of getting tested at the beginning of any symptoms. That is when this testing really makes the biggest difference. So even if you think that the allergies are getting a little worse, you're not feeling really well, and you're just wondering if something's coming down, get tested early, get tested often. It just makes a gigantic difference to make sure that you know if you have got the disease and if you can prevent the spread to others around you. And so just really encouraging that testing early on. Moving on to the next slide, I thought this was an interesting slide. This was a national one. It gets a little bit old data. It's September 1st through 14th. And it looks at the number of cases per 100,000, and it compares it to the number of tests per 100,000. So you can see that yellow arrow there is pointing to where Alaska is. And so we're kind of right along the median there for number of cases per 100,000 when you look nationwide. Once this slide was made, we've actually started to move up. So we're just over the median right now. You can see, however, that we're quite high compared to other states in our tests per 100,000. So Rhode Island continues to be a highly tested state and right up there with us. North Dakota's been doing a lot of testing, but you can also see that they're far off there with quite a few cases, greater than 550 cases per 100,000. And unfortunately, the Midwest is getting hit really hard right now. North Dakota, South Dakota, Wisconsin area, all getting hit quite hard at this time. And so it's just, I think it's a useful tool to kind of look at where we stand compared to some of the other states. The little red dots on there are states that have greater than 10% positivity. And so you can see some states there are really getting into that really high positivity rate. Unfortunately, while ours is clicking up, we're still not anywhere near 10%. So moving on to the next slide, this is the statewide data by age. This is pretty similar to what we see nationwide. We continue to see quite a few cases in that 20 to 29 age group, followed by the 30 to 39 age group. Probably a bunch of different reasons for this. People who are younger tend more likely to be asymptomatic or very mildly symptomatic, tend to work in critical infrastructure, have little kids around. There's a bunch of factors there, potentially more social and getting together. And so just a reminder that we're all really involved in minimizing the spread of this pandemic. And so all that we can do to truly get those numbers down and knowing that it affects every age group. Moving on to the next slide, this is just a reminder about the symptoms, and it's great to see many of the schools doing a lot of great work for just mitigation in general. Most schools are really promoting this symptom-free school policy right now, and it's great. So not having fever, cough, fatigue, loss of appetite, shortness of breath, sputum projection like runny nose, or just really achy. People can also have diarrhea and rashes associated with COVID. And so it's really important if people aren't feeling well to not go to school or not to go to work and to do that from home if all possible, because we really want to make sure that we're minimizing the spread to others so that people aren't getting sick. And then thinking a lot about who's in your social bubble and thinking about making sure that your bubble stays kind of tight and small. And we all have our different priorities on who we need to socialize with and for different reasons. Some people it's work, some people it's school, and really making sure that we're doing everything we can to minimize that interaction with others, that we don't have to. And if we do, we have a mask on and we're trying to minimize that time. So moving on to the next slide, I thought this was an interesting and useful slide. So when we think about what are some of the risk factors for getting COVID and getting sick with COVID, so we can think about the environment. Indoor and outdoor ventilation, long-term care facilities, places like that, the more contact and kind of more congregate people are, is really your environment. The host factors, so thinking about that person in general and their risk factors for getting more severe disease, such as age, the severity of their infection, and other risk factors. Socioeconomic factors are clearly playing a role. So poverty, job insecurity, prolonged working hours, crowded households are all going to play a huge risk as well. And then the contact pattern, your proximity to the index case, how close you were, how long you were exposed, how much virus you received during that time, how frequently you contacted them. And so we've talked a lot about these 3 C's, avoiding congregate places, close contacts, and confined settings. But I think this is another way of thinking about it. What things can you change in your environment, your contacts? What ways can you make sure that you're taking care of your body, making sure that you are doing all that you can to take care of both your body, both mentally and physically, to minimize your host factors? And then thinking about how we can support each other with these socioeconomic factors to really make sure that everyone does well. Moving on to the next slide, we've shared this slide before, I still love it, and it's essentially box it in. So testing widely, isolating if someone's sick, remember isolation is for illness, then contacting anyone they've been in contact with during their infectious period, and that is a team effort, both for you contacting your contacts and us working with you to do that, and all of those close contacts, fully quarantining for those 14 days. Quarantine 14, full 14 days away from other people. There's no test-based strategy to make that quarantine shorter at this time. It's really frustrating. It's a long time. Just this virus has a long incubation period. And so we really need people to quarantine for that full 14 days if they were in contact with someone who was COVID positive since the last time they were in contact with them. Moving on to the next slide, I also thought that this was a really useful slide and seems to really help to put a diagram to what we see a lot from our contact tracing investigations. And so we may think we have a bubble. So, if I'm this person doing this little dance in the middle of the purple bubble, that may be my bubble. But then, there might be 2 people in my bubble who are part of another bubble because they, maybe that's the people that I work and live with in my purple bubble, but then they live and work with other people, or they, those are people from their kids or their school or their daycare. And so you can have COVID in one of those bubbles, and it may not be your bubble, and it can move from bubble to bubble to bubble until it can move into your bubble. And so we really need to think about how porous our bubbles are. But the other thing about this is we need to really encourage people, again, to test early and to quarantine, because if we can identify that case within that orange bubble early, we can prevent it from moving to the red bubble, to the blue bubble, to the purple bubble, and continuing to spread really, really quickly. And so really want to encourage people to test, not only to protect your bubble of people, but who else they might be in contact with as well. Moving on to the next slide. So this is flu season. So we really are encouraging everyone to get their flu shot this year. A bunch of different reasons to get your flu shot. First of all, flu shots help to minimize the chance that you get influenza. It helps to minimize the chance that you would require hospitalization and minimize the chance that you may pass away. Fortunately, we did have 11 people die last year from influenza, 3 children and 8 adults. And there are some people who can't get the flu vaccine. The other reason it's really important to get the flu vaccine this year is we are tight on beds already. We have a very limited healthcare infrastructure in the state. And while they're not tight because of just COVID, they're tight because of all sorts of reasons. As we enter the flu season, we really want to make sure we keep as much of our healthcare capacity open as we possibly can to support each other. So this is the year to get your flu shot, and you want to do that before the end of October. Moving on to the next slide, each time a leaf turns and it falls to the ground, I keep thinking more and more about winter and what we can do. We as Alaskans are prepared for the winter and think about the winter, changing snow tires out and thinking about our water systems and what else we can do. And so make a health plan for your winter as well. And so here's a little checklist of things to do to get ready for the winter. So the first is to make a plan to stay physically active and mentally well. And what that means is going to be different for each person, but we really want to make sure that people are mentally and physically well. Make sure that you're eating a healthy diet. There's more and more evidence that vitamin D deficiency can make COVID symptoms worse. And a lot of Alaskans are vitamin D deficient, so you want to make sure that you've got adequate vitamin D. We want to make sure that people are staying connected virtually. The winters can be long and dark, and so finding ways to stay connected without being indoors with other people. Building time in to relax. COVID has been long and fatiguing. We want to make sure that you're taking time to take care of each other and yourself. Want you to make sure that you're checking your indoor air quality. So this might be at work. This is happening a lot at the schools, and thinking about good air exchange because we know this can play a difference in minimizing respiratory infections, including COVID. You should have a plan to quarantine and isolate in case you are diagnosed with COVID or you are asked to quarantine. So that's having enough medications or food in the house for a full 14-day period and making sure that you have what you need, maybe daycare, maybe separation from others, to make sure that you've got a plan. And again, avoiding those 3 C's, closed spaces, crowded places, and close contacts. Doing the 3 W's, wearing a mask, washing your hands, and watching your space. And then we're an amazing community. Check on your elders, check on your neighbors, see what they have, and make sure that they're ready for winter as well. So with that, just want to thank everyone for their time and this weekly update. Again, we encourage you to join any of our echoes. If you have further questions, we have our science echo every Wednesday from 12 until 1. You can ask our team any science questions you want. We have school echoes, EMS echoes, healthcare provider echoes, vaccine echoes, and trying to really do whatever we can to encourage a two-way dialogue between the state as well as Alaskans. We learn so much from you, so many great creative ideas. We want to hear from you, and we want to make sure that you have a chance to hear from our team. So with that, I hope everyone has a great night and a great week. Let's drive these numbers back down, and we will talk next week. Thanks so much.